today we are going to learn about Cotrimoxazole in just 2 minutes with all the simple tricks I'm going to help you guys. So first, if they ask about Cotrimoxazole, they'll ask about mechanism of action, its pharmacokinetics, its adverse effect and uses. These are the 4 points almost every question they'll ask. Okay, first let's come to the mechanism of actions. So when you remember this Cotrimoxazole, just remember PABA. Okay, Cotrimoxazole, PABA. So you know the sequence of PABA, right? PABA getting converted into dihydrofolic acid and tetrahydrofolic acid. This PABA to dihydrofolic acid, you need folate synthase, and dihydrofolic acid to tetrahydrofolic acid, you need dihydrofolate reductase. यहाँ पे synthase आता है, यहाँ पे reductase आता है. That is you must remember. Okay. First step is by sulf-methoxazole, and second step is trimethoprim. This is all about its mechanism of action. I have written here, you can just take the screenshot and the notes, its mechanism of action. Then what you can write more about it is there is sequential blockade, so it will give super additive effect. Okay, and these have similar half-lives, that sulf-methoxazole and trimethoprim have similar half-lives, that is why they are engaged. Then how they are present in 5:1 ratio. For super additive effect, for perfect effect, they are in 20:1. That is more enough. And you can also write they'll be in bactericidal effect, from bacteriostatic to bactericidal effect, and antimicrobial resistance is less seen. Then through oral, well absorbed, it can go to even CSF, metabolized from the liver and excreted in the urine. Now let's come understand about adverse effect. See, these are main. You can't write only nausea and vomiting and end up everything. Okay, so these are main. First we'll see adverse effect. You have a mnemonic to remember, that is GEMS bone. How will you remember? GEMS bone. Cotrimoxazole, GEMS bone. Cotrimoxazole. Can you just hear the word called as Cotrimoxazole? It's like gem, some gem name, ruby, Cotrimoxazole. See, so GEMS bone. GEM is gastrointestinal disturbance, exfoliative dermatitis, megaloblastic anemia, Stevens-Johnson's syndrome, it is rare, and bone marrow suppression. And bone, you will remember bone marrow suppression. Here O and N you remember, occasionally neutropenia, leukopenia, thrombocytopenia, and E asthma multifora. This is you must remember. Then uses. For uses also I have a funny mnemonic for you to remember, that is UTI boy ran to cold places. See, remember UTI infection. Whenever you ask a patient about the UTI infection, what you ask, the main thing you ask is burning sensation, right? You will ask about burning sensation. Is the person having some burning sensation? So burning, the person UTI infected. So UTI boy ran to cool places because he had burning sensation. So he ran to cool places because he had no card to enter into the AC room. That is not, remember, you just remember no card. UTI boy ran to cool places. UTI, they are used in UTI infections, like mostly in gram-negative bacteria, like twice for 3 days. Just remember. Then bacterial diarrhea, like salmonella, shigella, you can write. Then respiratory tract infection, mainly you have Haemophilus influenza going to cause sinusitis and otitis media. Then typhoid fever, mostly used are fluoroquinones and third generation cephalosporins, but for typhoid fever even Cotrimoxazole is used. Then charnoid, which is found in H. diphtheria, and pneumonitis gigovia infections in AIDS patients, so these are used. Then nocardiasis, for nocardiasis. Thank you.